Thank you, Dr. Aroni. Our last speaker is Nikki Massie. Nikki is a professional writer, marketer, and online community leader living in Baltimore, Maryland. She received her Bachelor of Arts in English from University of Maryland, Baltimore County, and her Master of Arts in Contemporary Communications from Notre Dame of Maryland University. In January 2008, Ms. Massie underwent Roux-en-Y gastric bypass surgery under the care of Dr. Kuldeep Singh at St. Agnes Hospital in Baltimore. As a result of surgery, she has maintained a weight loss of 125 pounds. Since her surgery, Ms. Massie has become a community leader and patient advocate within the bariatric community, running a popular recipe website called Bariatric Foodie. She also serves as a board member of the Obesity Action Coalition.
Thank you. Unlike my fellow panel members, I am okay with the 10 minutes that I have. So I wanted to start off by saying that so far as my history with obesity goes, it can probably be summed up in one very simple sentence. There has never been a time in my entire life, including after bariatric surgery, where I was not at least overweight, and most of my life I have had obesity. I started to research bariatric surgery as a treatment for obesity after not really having tried meaningfully other interventions. I had an on-again, off-again relationship with primary care physicians. I never kept one for very long. Some of that had to do with insurance gaps when I became a young adult and sort of got kicked off of my parents' insurance. And part of that just was an aversion to interaction with the medical community at large. So my first meaningful attempt to address my obesity would have been my researching into bariatric surgery. That began at about 2007. And I presented at about 340 pounds, which is what I am in this picture. This is a little bit of an older picture, but understandably, and I think we can find this with a lot of patients who have severe obesity, I was not prone to jumping in front of cameras. So in this picture, I was 340 pounds. The first interaction I had with my bariatric surgeon, Kuldeep Singh, at St. Agnes Hospital was an informational session. It was basic Q&A informational session. I learned that the practice performed 2 surgeries at the time that I went there. They did Roux-en-Y gastric bypass, and they did the laparoscopic adjustable band, or lap band, surgery. I went to my initial consult with my surgeon, and after doing an initial just sort of physical examination, I was told that I would probably benefit more from surgery if I had a primary care physician, which I did not at the time. I researched, got one who I felt was amenable to me having bariatric surgery and to working with my bariatric team. Going back to my surgeon, he had originally suggested lap band for me because at the time that I presented, I didn't have any associated conditions going on. I was not, amazingly, at 340 pounds, I was not even pre-diabetic at that time. I didn't have high blood pressure, so I was relatively, as he described it, healthy for a person with obesity. And so it was suggested that I get the lap band surgery. By this time, I had read up on both of my surgery options. I did not feel that the lap band surgery was the right surgery for me. Specifically, I had read about the possibility with the Roux-en-Y gastric bypassing of the phenomenon known as dumping syndrome. And I know that psychologically, the dumping syndrome would probably work as a tool for me to stay compliant with what my surgeon told me to do. My brain does not grasp things that I should not do. It does grasp things that I cannot do, and I knew it would only take being sick a few times for me to grasp that. So I went through the rigmarole of the standard preoperative testing. I was required to consult with a nutritionist. They had a nutritionist that was affiliated with the hospital but was not on staff and also was not covered by my insurance. So I paid out of pocket for that. I was initially told by my insurance company that I would not have to do a 6-month preoperative diet when I first contacted them about getting covered for bariatric surgery. However, once I went through going to the dietitian, going through a psychological evaluation, and their office submitting everything to my insurance then came back and told me, well, actually, we changed our mind. Yes, you do have to go through a 6-month preoperative diet. So I worked with the nutritionist on staff at my bariatric practice to do that. However, 3 months into that diet, I was then told by my insurance company that I was approved for surgery. So I scheduled my surgery, had my surgery in January of 2008. I didn't have to have too many extraneous tests preoperatively. I had, general, very standard preoperative blood work. I did have a stress test before my surgery. I did not have to have a sleep study or anything like that. So I went into surgery, and by all measures, my outcomes were good. My surgeon and I agreed, and we talked last week, that I maintained a higher weight than what I thought I perceived myself to be in terms of size. There was a schism between the weight that was on the scale and the size that's on the scale. And this next picture is a pretty good example of that. And forgive the cliche, weight loss. I lost weight, and so now I want to wear skimpy clothes type picture. In this picture, I am 172 pounds. This is about 11 months post-op. In this picture, I was 172 pounds. The dress I was wearing, I always joke, was a size 6, which represents that sort of schism between where I thought I should be and where I was in terms of weight. But it also represents one of the sort of gaps that I feel might have persisted in my care, which was that I was unable to consistently keep up with psychological care. There was not a psychologist on staff in my bariatric practice. It was up to me to keep up and maintain psychological care on my own. I had trouble with that because I had some gaps in my insurance. And so navigating those schisms between what size you are in clothes, what size you are on the scale, and things like that all became difficult for me. However, in terms of my bariatric follow-up, I did have pretty intensive follow-up for the first 2 years after my surgery. I remember that I had a 2-week follow-up appointment, 3 months, 6 months, 9 months, 12 months, 18 months, and then after 18 months, it was a year, every year after that. Another sort of barrier and challenge for me personally was my history of support and interaction with primary care physicians. It's only recently, within the last 2 years, that I've actually maintained the same primary care physician for any length of time. And so when I wasn't seeing my bariatric surgeon, I wasn't tending to get any sort of routine medical care at all, and I was not necessarily connected to their dietitian, who subsequently left the hospital, and I wasn't necessarily consistently connected to psychological care. All of those factors, plus probably many more that I don't even know about, led to a slight regain after weight loss surgery. So this is sort of a recent picture of me. I now sort of sit, and for the last 4 or so years have sat at about 205 pounds. That is a weight that I can maintain pretty easily. I maintain a fairly regular exercise routine. I maintain a regular vitamin regimen. I do meet with a dietitian now, so I've worked with her for about the last year or so. To regulate my eating, my caloric intake, and things like that. I do still see my bariatric surgeon once a year, and that actually comes in very handy because of the fact that my bariatric surgery care is a part of my overall health care. And so it affects other things in my life and other realms of healthcare in my life. Last year, I was diagnosed with a very early stage of breast cancer, and I had a bilateral mastectomy for treatment. Afterwards, my micronutrient levels did some funny things, and my doctor wasn't understanding the pattern of how that was happening. So I was able to get him connected to my bariatric surgeon to talk about whether or not these were things that were necessarily of concern because of the surgery I had, because of being treated for cancer, or whether it was something that was relatively normal for somebody who is 8 or 9 years post-op gastric bypass surgery. So I felt that was very important, that link between my primary care physician and my bariatric surgeon. So I still do see him once a year. I follow up actually with my primary care physician every 6 months for a variety of reasons, for labs and things like that. And they have a good relationship now and work together to monitor those sorts of things. I did have a chance to talk with our bariatric nurse practitioner at our practice because of the fact that it has been 9 years since I've had surgery, and I know that a lot of things have changed. Mainly, they have brought aboard more dietitians onto their practice. They have actually programs both for the preoperative education, and I did undergo preoperative education before I went through surgery. It was one class, but they now have a series of classes. They have a more robust both in-person and online support group via a private Facebook group. There is also a program that patients can elect to go into as a longer-term post-op if they experience regain, which is focused around both dietary changes and behavior changes. And that's a program that is led by the dietitian and by a psychologist. So these are all things that are available to folks now. They're available to me now as well, but did not exist when I first had surgery. Now, my surgeon's office, in addition to Roux-en-Y gastric bypass, they no longer perform lap band surgery, although they maintain lap band surgery services. So they continue to give people fills if they already have lap bands and continue to maintain their care, but they don't perform new surgeries with the lap band. And they are now obviously performing the vertical sleeve gastrectomy as a surgery, and that she expressed that is increasing over the years. So that has been my patient experience as a weight loss surgery patient. I consider the outcome that I got very successful in terms of lifestyle intervention and changing how how I move, how I eat, how much I eat, and things like that. I have experienced a couple of things, such as the I call them special blood sugar moments, but I guess you would call them hypoglycemia, and things like that. But on the overall, I feel like I have had a very successful experience in the overall treatment of my obesity so far through bariatric surgery. Thank you.